What if you could wake up every morning with legs that feel sturdy, powerful, and full of vitality? With the right nutritional support, those days of muscle weakness, excruciating cramps, and worry about falling might become distant memories. Revitalizing your leg health requires more than just exercise. It demands specific nutrients working together. Within this comprehensive guide lies the key to understanding how certain vitamins and minerals can transform your mobility. From muscle strength to bone density and proper circulation, these powerful elements create a complete support system for aging legs. No single nutrient stands alone in this process. Rather, they combine like musicians in an orchestra, each playing its unique part while contributing to a harmonious whole. When properly balanced, this nutritional symphony can dramatically change how your legs feel and function. Are you curious about what might be missing from your daily regimen? Join us as we explore the foundation of leg health and discover how targeted nutrition can help you stand strong for years to come. Many seniors accept the gradual decline in leg strength as an inevitable part of aging. They shouldn't. Behind this common deterioration often lurks an invisible culprit: vitamin D deficiency, which silently weakens muscles and compromises stability. Why does this happen? The aging body simply doesn't manufacture vitamin D like it once did. By your 70th birthday, your skin produces approximately 75% less vitamin D from sunlight than in your younger years. Coupled with reduced outdoor activity that many seniors experience, this creates a perfect storm, a progressive deficiency that steadily erodes muscle strength. Vitamin D's role in your muscles extends far deeper than most realize. Deep within your muscle cells, this powerful nutrient binds to specialized receptors, triggering the activation of genes responsible for muscle fiber growth and repair. These cellular interactions prove particularly crucial for the large leg muscles that support everyday activities. Without sufficient vitamin D, these fibers weaken and shrink, making simple movements like rising from a chair or climbing stairs unexpectedly difficult. Why should this concern you? The Journal of the American Geriatric Society published compelling research establishing a direct link between vitamin D levels and fall risk. Their findings? Seniors maintaining blood levels above 30 ndml experienced 20% fewer falls than those with lower levels. This striking difference highlights vitamin D's crucial role in preserving independence. Your neuromuscular system, that complex communication network connecting brain to muscles, cannot function optimally without sufficient vitamin D. It maintains those critical, fast-twitch muscle fibers that spring into action when you stumble on uneven pavement. Beyond this protective function, vitamin D drives protein synthesis in leg muscles while simultaneously reducing inflammation. Such dual action translates to less pain, decreased stiffness, and remarkably improved recovery after physical activity. How can you boost your vitamin D levels? Start by seeking sunshine. Just 15 to 20 minutes of direct sunlight on arms and legs several times weekly often suffices, though requirements vary based on skin tone and geographic location. Don't rely on sun alone. Incorporate fatty fish like salmon, fortified milk products, and egg yolks into your diet. Despite these efforts, most seniors still benefit from supplementation. Daily doses of 1,000 to 2,000 IU help many, but only your doctor can determine your precise needs through blood testing. Aim for blood levels between 30 to 50 ngml for optimal results. Consider Margaret's experience. At 78, she had reluctantly abandoned her beloved daily neighborhood walks as leg weakness progressively limited her mobility. Her physician recognized the symptoms and recommended vitamin D supplementation. After just 3 months, Margaret had regained sufficient strength and stability to resume her cherished walking routine. The transformation can be nothing short of remarkable when vitamin D reaches appropriate levels in your system. Within weeks, many seniors notice significantly improved stability. Their confidence while walking returns. Leg strength increases noticeably. Previously abandoned activities become possible again. The persistent fear of falling, that constant companion of many older adults, diminishes substantially. This single nutrient might make the critical difference between dependent living and maintaining your precious mobility throughout your senior years. Strong muscles need clear commands. While vitamin D builds muscle strength, you need another crucial nutrient to ensure your brain communicates effectively with those muscles. Have your legs ever failed to respond as quickly as they once did? The culprit might be vitamin B12 deficiency. This deficiency creates a genuine disconnect, similar to making a phone call with terrible reception. Your brain sends movement signals, but these messages arrive garbled or fail to reach their destination entirely. The result? Weakness, decreased stability, a growing sense of uncertainty with each step you take. Surprisingly common yet frequently overlooked, B12 deficiency affects up to 20% of older adults. Why does this happen? Your aging body undergoes significant changes after 50. Stomach acid production, essential for extracting B12 from food, decreases dramatically. Meanwhile, your intestinal lining gradually loses its absorption capacity, making it increasingly difficult to capture what little B12 gets released. Even seniors meticulously following balanced diets frequently fail to obtain sufficient amounts of this vital nutrient. At its core, vitamin B12 maintains the myelin sheath, a protective coating around the nerves carrying signals to and from your legs. Think of myelin as the insulation around electrical wires. When this insulation wears thin due to B12 deficiency, nerve transmission becomes unreliable, like a faltering telephone line during a storm. Signals controlling leg movement weaken or misfire, directly affecting muscle response during walking, standing, or balancing. B12 deficiency symptoms progress in a predictable pattern, beginning with mild tingling or pins and needle sensations in the feet and legs. Left unchecked, this advances to numbness, loss of position sense, and eventually, significant weakness. These symptoms can transform simple daily activities like climbing stairs or walking to the mailbox into challenging ordeals, compromising independence and quality of life. Many medications commonly prescribed to seniors actively reduce B12 levels. Antacids and acid-reducing drugs decrease stomach acid essential for B12 absorption. Metformin, the most prescribed diabetes medication, can lower B12 levels by 30% with long-term use. Some heart medications can interfere with B12 utilization at the cellular level. Research shows remarkable improvements in leg function when B12 deficiency is corrected. Seniors with normalized B12 levels demonstrate measurable gains in leg strength, walking speed, and stability. One study documented a 28% reduction in fall risk following B12 restoration, meaning for every 4 falls that might occur, at least 1 could be prevented, potentially avoiding serious injuries and hospitalization. Strong muscles need clear nerve signals, but they also require proper relaxation. While vitamins D and B12 maintain strength and communication, another nutrient addresses perhaps the most agonizing leg issue seniors face: muscle cramps. It starts at 2:30 a.m. Without warning, pain strikes. A severe vice-like grip seizes your calf muscle, jolting you instantly from peaceful sleep. Your muscle hardens like stone as the cramp intensifies. You find yourself gasping, desperately massaging your leg, hoping for relief. Come morning, sore and tender muscles make those first steps uncertain and wobbly. For countless seniors, this scenario repeats night after night, creating a devastating cycle of poor sleep, limited mobility, and growing fear of movement. Why do these painful episodes occur? Often, the answer lies in magnesium deficiency. This mineral functions as your body's master regulator for muscle function. Much like a skilled conductor directing a complex orchestra, magnesium orchestrates the delicate balance between contraction and relaxation in your leg muscles. When levels drop too low, this balance tips drastically toward contraction. Your muscles, unable to fully relax, remain partially contracted, primed for painful cramping. Operating directly at the cellular level, This essential mineral controls the critical movement of calcium and potassium across muscle cell membranes. The calming effect of magnesium on your nervous system prevents overactive nerves from sending unnecessary signals that trigger painful spasms in your legs. Without sufficient magnesium, nerve cells become hypersensitive, firing repeatedly and causing muscles to contract painfully. Magnesium and calcium function as opposing forces. Calcium signals muscles to contract, while magnesium signals them to relax. As we age, this balance often shifts, particularly when magnesium levels drop, leading directly to those involuntary contractions that characterize leg cramps. Research confirms magnesium's effectiveness for both nighttime cramping and restless leg syndrome. One study showed participants taking magnesium supplements experienced a 50% reduction in leg cramp frequency and severity compared to those taking a placebo. After months of disrupted sleep from leg cramps, I started taking magnesium before bed, shares Martha, 72. Within 3 weeks, I was sleeping through the night again and waking up without that terrible soreness. Several factors accelerate magnesium depletion in seniors' chronic stress. Common medications like diuretics, and processed diets lacking in magnesium-rich foods. Excellent food sources include dark leafy greens, legumes, nuts, especially almonds, seeds, and whole grains. When supplementing, magnesium citrate and glycinate forms are most easily absorbed by aging digestive systems. Beyond preventing muscle cramps, magnesium improves circulation in the legs by relaxing blood vessel walls and plays a crucial role in converting food into energy within muscle cells. The primary energy molecule, ATP, requires magnesium to function properly, improving endurance for daily activities. For optimal results, take magnesium supplements about an hour before bedtime, when cramps most commonly occur. A typical starting dose ranges from 200 to 400 milligrams daily, though individual needs vary. Increasing intake gradually helps avoid digestive side effects while allowing your body to rebuild its magnesium stores, often providing noticeable relief within 2 to 3 weeks of consistent supplementation. Relaxation represents only half the equation for proper muscle function. While magnesium helps muscles release tension, potassium, its perfect partner, enables the contractions necessary for movement. Do your legs ever feel weak, tremble uncontrollably, make walking unexpectedly difficult? Potassium deficiency might be the hidden culprit lurking behind these symptoms. Countless seniors struggle with these issues daily without ever identifying the true cause. Perhaps your legs feel unusually heavy when rising from a chair. Maybe they shake when you attempt to stand. Sometimes they simply lack the strength to support normal activity. These aren't inevitable consequences of aging that you must passively accept. They often signal that your potassium levels have dropped dangerously low. Potassium serves as a critical electrical conductor in your body, especially for leg muscles. Every movement you make relies on electrical signals traveling between your nerves and muscles. When potassium levels drop, this communication becomes garbled, resulting in poor muscle response and coordination. Inside each muscle cell, potassium maintains the perfect fluid balance, regulating how much fluid stays inside versus outside your muscle cells. This directly affects their strength and functionality. With low potassium, this delicate balance shifts, causing cells to either swell or shrink abnormally. The result? Muscles that contract weakly or unpredictably, making your legs feel unstable during daily activities. Many common medications prescribed to seniors actively deplete potassium stores. Diuretics, often called water pills, increase urination to control blood pressure while flushing potassium from your system. Other blood pressure medications affect potassium levels by altering kidney function, creating significant risk without compensating for this loss. Research connects low potassium to increased fall risk in older adults. One study found that seniors with lower range potassium levels experience nearly 30% more falls than those with optimal levels. This translates to a substantial increase in potential injuries that could lead to hospitalization or loss of independence. Maintaining proper potassium directly supports mobility by preserving leg strength and stability. In most seniors' diets, sodium is abundant while potassium is insufficient. This imbalance weakens the electrical potential needed for strong muscle contractions, directly impacting your ability to stand and walk confidently throughout the day. While bananas are known for potassium content, other foods provide even higher amounts. A simple breakfast of yogurt topped with sliced banana and a small glass of orange juice provides nearly 25% of your daily potassium needs. Other excellent sources include potatoes with skin, avocados, spinach, beans, and salmon. For seniors with chewing difficulties, potassium-rich smoothies offer an accessible alternative. Beyond muscle function, potassium helps maintain healthy blood pressure, improving circulation to leg muscles. This improved blood flow reduces cramping and fatigue during daily activities. For seniors with kidney concerns, balancing potassium requires special attention. Always consult your doctor about appropriate intake if you have kidney disease, diabetes, or take medications affecting kidney function. To maintain consistent leg strength, include potassium-rich foods in each meal, rather than loading up at one sitting. This steady supply keeps electrical signals to leg muscles functioning optimally all day, providing the stable strength needed for confident, independent movement. Muscle function depends on precise chemical signals. But what about the structural framework supporting these muscles? Having explored how magnesium and potassium affect muscle contractions, we must now turn our attention to the mineral that literally builds your skeletal foundation. Calcium deficiency presents a dangerous double threat to aging legs. Unlike other nutrients that primarily affect one aspect of mobility, inadequate calcium simultaneously weakens both bones and muscles. When levels drop below optimal thresholds, bone density decreases while muscle function deteriorates in parallel. This devastating combination makes legs particularly vulnerable. Fracture risk increases precisely when the muscle strength needed to prevent falls diminishes. Tragically, many seniors experience this dual decline for years without ever realizing that addressing a single nutrient deficiency could significantly improve both problems. Think of calcium as the mortar that holds together both your skeletal framework and muscular architecture. Without sufficient mortar, the entire structure becomes unstable. This instability manifests in everyday challenges like rising from a chair, climbing stairs, or catching yourself when off balance. Throughout life, your bones undergo a continuous process called remodeling. Old bone tissue breaks down while new bone forms. After age 50, this balance shifts dramatically, with breakdown outpacing formation. This biological change makes calcium intake crucial for seniors, as their bodies become less efficient at incorporating calcium into bone tissue. Research published in sports medicine journals demonstrates calcium's impact in preventing stress fractures in the lower extremities. One study followed older adults over 3 years and found those maintaining adequate calcium intake experienced 35% fewer stress fractures compared to those with poor calcium consumption. At the cellular level, calcium enables muscle contraction when your brain signals movement. Calcium ions flood into muscle cells, binding to proteins that allow muscle fibers to generate force. Without sufficient calcium, this process becomes inefficient, leading to weak contractions, slower response times, and reduced stability when walking. Weight-bearing exercise creates a powerful synergy with calcium. Activities like walking or resistance training apply controlled stress to bones and muscles, signaling where calcium is most needed. This ensures calcium strengthens the specific leg bones and muscles used during daily activities. While dairy products provide calcium, alternatives exist for those with lactose intolerance. Dark leafy greens, canned sardines with bones, almonds, and calcium-set tofu all contribute significant amounts. Fortified plant milks and cereals can also help meet daily requirements. Finding the right calcium balance proves crucial. Aim for 1,000 to 1,200 milligrams daily from combined food and supplement sources. Exceeding 2,000 milligrams daily may increase kidney stone risk. Calcium also helps maintain joint health in knees, ankles, and hips, contributing to cartilage integrity and supporting smooth movement. This protection becomes increasingly important as joint surfaces naturally wear with age. For optimal absorption, Divide calcium intake throughout the day rather than consuming it all at once. The body can only absorb about 500 milligrams at one time. Take calcium with vitamin D to increase absorption by 30 to 80%, and consider calcium citrate with meals if you have reduced stomach acid, a common condition in seniors. Strong muscles need oxygen. Healthy bones need nutrients. Having established a solid foundation of muscle and bone support through the nutrients we've discussed, we must now address another critical, yet often overlooked aspect of leg health: circulation. What happens when blood flow to your legs becomes compromised? A cascade of uncomfortable symptoms emerges. Feet and ankles remain cold even in warm weather. Legs feel inexplicably heavy, seeming to drag with each laborious step. Ankles swell without apparent cause. Stamina disappears quickly during even the simplest activities. A short shopping trip or merely walking to retrieve mail becomes exhausting. These aren't merely inconveniences. They represent a profound decline in quality of life and independence affecting thousands of seniors across the country. For those seeking relief, vitamin E offers a powerful solution by directly targeting the root causes of leg discomfort and mobility challenges. Vitamin E functions as a powerful antioxidant, specifically targeting the blood vessels in your legs. These vessels naturally accumulate damage over time from free radicals, unstable molecules that attack and weaken blood vessel walls. Vitamin E neutralizes these harmful compounds, preserving the flexibility and structural integrity of your arteries and veins. This protection is especially important in the small, distant vessels of the lower extremities that deteriorate first with age. When blood vessels remain healthy and flexible, blood flows more easily to leg muscles. This improved circulation delivers oxygen and nutrients to muscle cells more efficiently, resulting in increased endurance during walking, less fatigue when standing, and legs that feel lighter and more responsive. Many seniors notice this improvement within weeks of optimizing their vitamin E levels. Vitamin E helps prevent dangerous blood clots by reducing platelet aggregation, the tendency of blood cells to stick together. This natural blood thinning effect keeps circulation flowing smoothly through small vessels, without creating the bleeding risks associated with medication. Clinical research published in the Journal of Vascular Surgery demonstrates vitamin E's effectiveness for peripheral artery disease. Participants receiving vitamin E supplementation increased their pain-free walking distance by 26% compared to controls, allowing many to enjoy leisurely neighborhood strolls or shopping trips without the cramping pain typically associated with poor circulation. Vitamin E helps neutralize reactive oxygen species that accumulate after physical activity, allowing muscles to repair more efficiently. With adequate vitamin E, leg muscles bounce back more quickly after walking or exercise, which becomes increasingly important as we age. Excellent food sources include sunflower seeds, almonds, spinach, avocados, and olive oil. A handful of almonds provides about 7 milligrams, roughly half the recommended daily intake. Supplementation typically ranges from 100 to 400 IU daily, though higher amounts should only be taken under medical supervision. Vitamin E reduces inflammation in leg veins and arteries through multiple pathways, helping blood vessels maintain their proper diameter and function. Meanwhile, it works in harmony with omega-3 fatty acids from fish, flaxseed, and walnuts to provide comprehensive protection by addressing both inflammation and oxidative damage, a combination far more effective than either nutrient alone. For maximum benefit, combine vitamin E with regular movement throughout the day. Even gentle activities like ankle circles, calf stretches, and short walking breaks significantly enhance circulation when paired with proper nutrition. Blood flow delivers nutrients. But what if your body lacks the materials needed for repairs? Now that vitamin E has improved circulation to your legs, we must ensure your body can maintain their structural integrity. Time transforms your body's connective tissues. Those resilient, flexible tendons that once moved smoothly through thousands of steps daily, they gradually lose elasticity. Your ligaments, once strong cables stabilizing your knees and ankles, they become stiff, prone to injury. The fascia wrapping your muscles? It tightens and loses flexibility. This natural deterioration doesn't happen overnight, but its effects become increasingly apparent: unstable joints, decreased range of motion, and noticeably reduced mobility. Many seniors discover their knees becoming progressively unreliable. Their ankles twist more easily on uneven surfaces. Overall leg movement becomes increasingly restricted. While some degree of change is inevitable, the rate and severity of this deterioration varies dramatically between individuals. Why such difference? The answer lies partially in nutritional factors, particularly vitamin C levels. Vitamin C serves as the primary building block for collagen production in your body. Collagen makes up approximately 30% of all protein structures in the human body and forms the essential framework that gives strength and structure to the connective tissues in your legs. Without adequate vitamin C, collagen formation becomes impaired, resulting in weakened structural support for leg muscles and joints. Vitamin C is the glue that binds and repairs your body's support network. The tendons connecting muscles to bones, ligaments linking bones together, and fascia wrapping around muscles all depend on vitamin C for proper maintenance, providing critical stability during walking and standing. When vitamin C levels drop, these tissues lose tensile strength and resilience, becoming vulnerable to tears and strains. As a powerful antioxidant, vitamin C protects leg muscles from oxidative damage. When you use your legs, microscopic damage occurs in muscle fibers. Vitamin C neutralizes the free radicals produced, reducing inflammation and speeding recovery, especially important as aging naturally slows recovery processes. Research shows vitamin C accelerates healing of micro-injuries in leg tissues by approximately 20%. This improvement means faster recovery from daily activities, less accumulated stiffness, and maintaining mobility for everyday tasks like climbing stairs or walking longer distances without discomfort. Vitamin C improves the absorption of non-heme iron from plant foods, preventing iron deficiency anemia that often manifests as leg weakness and fatigue in older adults. By ensuring proper iron absorption, vitamin C helps maintain energy levels in leg muscles during extended activities. For optimal tissue repair, incorporate vitamin C throughout your day. Excellent sources include citrus fruits, strawberries, bell peppers, broccoli. Try adding orange segments to breakfast, bell peppers to lunch salads, and broccoli with dinner. The body absorbs smaller amounts more efficiently, so spacing intake is ideal. For supplementation, 500 to 1,000 milligrams daily, divided into morning and evening doses, provides optimal support. Vitamin C supports collagen synthesis in cartilage and joint linings, maintaining cushioning in knees and ankles where decades of wear accumulate. It also strengthens capillaries, delivering nutrients to leg muscles, preventing the small hemorrhages that cause easy bruising in older legs. By maintaining consistent vitamin C levels throughout the day, you support the continuous process of collagen formation and tissue repair, helping your legs maintain their strength, flexibility, and stability for years to come. Calcium alone isn't enough. We've explored how this mineral builds strong bones, but a crucial question remains unanswered. How does your body ensure calcium actually reaches your bones instead of floating aimlessly in your bloodstream? Enter vitamin K, the unsung hero of bone health. While calcium captures headlines and remains the celebrity of bone-building nutrients, vitamin K works quietly behind the scenes. This essential nutrient serves as the body's traffic director for calcium, ensuring proper destination and utilization. Without adequate vitamin K, calcium molecules wander freely through your circulatory system. Instead of strengthening bones, this misguided calcium often deposits in dangerous locations, hardening arteries and accumulating in soft tissues. Such misdirection creates a paradoxical situation. Your body contains sufficient calcium, yet it fails to reach leg bones where it's desperately needed. Meanwhile, calcium accumulation in blood vessels causes stiffness and reduced circulation, further compromising the mobility your legs need to function properly. Vitamin K acts as a traffic cop for calcium in your body, directing it to bones where it belongs and away from places it shouldn't accumulate. There are two distinct forms, each serving crucial roles. Vitamin K1 comes primarily from plant sources and supports basic blood clotting functions. Vitamin K2 is more effective for bone health with a longer half-life, actively directing calcium into bone tissue and preventing arterial accumulation. At the molecular level, vitamin K activates osteocalcin, a protein that works like a magnet, binding calcium to the bone matrix in your legs and hips. Without sufficient vitamin K, osteocalcin remains inactive, leaving calcium unable to properly incorporate into bone structure. This process is particularly important in the weight-bearing bones of your legs, which need continuous reinforcement to support your body weight. Beyond bone strength, vitamin K reduces inflammation in knee joints, maintaining comfort and flexibility. Many seniors experience improved knee mobility and reduced stiffness with adequate vitamin K levels, allowing easier walking and improved confidence during daily activities. Research confirms vitamin K's importance. Seniors with higher intake experience up to 30% fewer fractures compared to those with lower intake. Bone density scans reveal better mineral content and structure in those consuming adequate vitamin K, particularly in hip and leg bones bearing the most stress. Vitamin K works best when combined with vitamin D and calcium. Vitamin D helps your body absorb calcium from your digestive tract, while vitamin K ensures this calcium reaches your bones. This three-way partnership maximizes bone strength. For vitamin K1, focus on dark leafy greens like kale, spinach, and collard greens. A cup of cooked kale provides nearly 10 times the daily requirement. For K2, choose fermented foods like natto, aged cheeses such as Gouda, and egg yolks. By preventing arterial calcification, vitamin K improves blood flow to your legs. Imagine the difference between walking with stiff, cramping calves versus moving with comfortable, well-nourished leg muscles. For those taking blood-thinning medications like warfarin, work with your healthcare provider to maintain consistent vitamin K intake. Rather than avoiding it completely, keeping levels steady allows medication dosage to be properly adjusted. Incorporate vitamin K-rich foods into daily meals by adding leafy greens to smoothies, enjoying aged cheese as a snack, or keeping sauerkraut as a quick side dish. These simple additions support strong leg bones and improved mobility. Through this guide, we've uncovered 8 essential nutrients that function not as isolated elements but as a harmonious ensemble, a nutritional symphony supporting strong, healthy legs throughout your senior years. No single nutrient alone can maintain optimal leg health. Each plays a distinctive role while enhancing the others. Vitamin D lays the foundation, strengthening muscles and improving stability with each step you take. Through complex cellular mechanisms, vitamin B12 protects those critical nerve pathways, enabling your brain to communicate effectively with your legs. When night falls, magnesium prevents those agonizing muscle cramps that might otherwise interrupt your sleep and limit daily activities. Working alongside it, potassium enables proper muscle contraction, providing strength and stability throughout your day. The structural support comes from calcium, building the framework for both bones and muscles. Yet without proper circulation, enhanced by vitamin E, oxygen and nutrients couldn't reach these tissues efficiently. Vitamin C maintains your connective tissues, literally holding everything together through collagen production. Completing this intricate circle, vitamin K directs calcium precisely to your bones where it belongs, preventing misplacement in soft tissues. Missing even one of these nutrients can compromise the entire system. Just as removing a violin from an orchestra changes its entire sound, nutritional deficiencies can dramatically impact your mobility and independence. Take control of your leg health today through balanced nutrition. Start by partnering with your healthcare provider to identify any existing deficiencies through appropriate testing.